Hello, everyone. I'm Dr. Amanda Stevens from AltaV Health, and I am a chiropractor who focuses in perinatal and pediatric care solely. That's the whole bit of everything we do here. And Hannah has asked me if I would go over a little bit about how your body changes during pregnancy and why sometimes those changes aren't handled as gracefully and result in you not feeling so great. So when we look at our pregnant body and posture here, it's good to know that, for one, if you're uncomfortable, you're not alone. Up to 95% of pregnant women are going to experience some pelvic girdle and or low back pain at some point during their pregnancy, and up to 75% of those women who do experience some low back or pelvic girdle pain during pregnancy are likely to have some recurrence of that pain within the next 3 years as well. So it does matter. It can impact your activities of daily living. It can impact your sleep. It can impact your capacity to care for your other kids, all these things. And so we don't want to just treat pain like a rite of passage. Pain's not a necessary part of pregnancy. And so our goal is always to make sure that you're feeling good and able to sleep and able to stay active, because if you can sleep and stay active, then everything is better. And so understanding your pain can help you deal with it properly. And we know now, in the last few years, there's been a lot of research that pain during pregnancy isn't just about hormones. And like I said, and it's not a necessary rite of passage either. We understand more and more now that pain during pregnancy, especially pelvic girdle and low back pain, is usually related to loading mechanics, which totally makes sense because that's usually what it is when you're not pregnant, and why we thought it would be something totally different in pregnancy. Who knows, right? But in pregnancy, there's a lot of changes to your loading and your biomechanics. You're going to have an increase in weight, which is going to add load to your tissues. You're going to have a shift forward in your center of gravity, which is going to change the direction of load on your tissues. And that's also very likely to result in a change in your posture during pregnancy. And, classically, you're going to see a tilt forward in the pelvis, an exaggeration of the lumbar spine. Now, to some degree, we are very likely to see this in pregnancy, and even to the point that the rib cage will often tilt up to 4 centimeters, which is quite substantial. But that doesn't mean we just give in to that sway, or that sway is necessarily helpful. Quite often what we're seeing is, because of how we've changed the loading in those tissues, the front, especially as your belly grows, gets overstretched and is kind of long and strung out a little bit. And then the back and the lumbar spine, the muscles and joints here get more compression and are holding on really tight. They're holding on so hard so that you don't fall over forward, basically. And so this is a scenario very much where movement is medicine, and that we want to make sure that you are able to move freely. We know that when it comes to acute low back and pelvic girdle pain, really any acute spinal pain, that movement is actually the #1 treatment for it. So we want you to be able to move your body, whether that's through yoga or going for a walk or whatever activities you're going to be doing. And so where manual therapy can come in, whether chiro or physio or whoever you're working with, is basically to make it so that you're able to do those movements appropriately, maybe coach you through how to do some of those movements if something's uncomfortable, helping you troubleshoot, and just basically facilitating your capacity to do all those things. Yeah. Do you have any other questions or anything else I can add to that?
No, that's so fantastic. So basically, what about upper back pain? Is it the same thing?
Oh, yeah. Upper back pain is actually much less common in pregnancy and comes to peak more so in postpartum. In postpartum, our postures are very flexion dominant, right? We come in to a very rounded posture, head down, caring for our baby, or possibly caring for a baby and a toddler at the same time, and your whole world is down below you. And those postures tend to lead more to stiffness and pain, discomfort within the upper back, and often going up into the neck and into headaches. It is something that if you do a little bit more upper body and posture training during pregnancy, you may be able to mitigate some of that. And that is usually what the focus is in postpartum care for upper back and neck pain. Tends to be focused on strengthening upper body pull based exercises and posture. Basically, postural training always comes down to posture, breathing, and core.
Posture, yes.
Yeah.
That's why we focus this whole week is on posture and yoga poses for posture. What about the most common thing you see, the most common adjustment you're doing in pregnancy?
This probably addressing the sacrum or dysfunction within the sacrum. The sacrum, if you look at our lovely little spine here, the sacrum is this triangular bone at the bottom. This little pointy bit at the very end of it is the coccyx. You have a little joint right here that's very much like a little knuckle here. And then the sacrum, which attaches to the ilium at what are called the SI joints or the sacroiliac joints. And then the spine is sitting on top of it. And so the sacrum is a really important bone for a slew of reasons, and the SI joints that are on either side of it. The SI joints only actually have about 5 degrees of motion. It's not a big motion that these guys have. It's not like your elbow, right? Like that can move through a huge range, but it's a really important range of motion because it does help to transfer forces, especially as you're moving, as you're walking. And it's that transition zone between stability, which is basically what your core is for, right? Like that trunk stability, and limb movement in your lower extremity. And so making sure that there is symmetry within the position and the loading of the pelvis is probably the most common area that we're looking at in dysfunction, in joint dysfunction during pregnancy. That has a little bit of added weight to it, not just in your movement, your stability, which obviously if we're unstable, we get more shearing, can cause more inflammation and irritation in those joints, or you can get compensation tightness of those muscles as well, which isn't very comfortable either. But we also actually have ligaments that attach from the front of our sacrum to the uterus. They're called uterosacral ligaments, and those uterosacral ligaments, if you've got a big shift in the sacrum, a big shift in that pelvis, there could be some pull on that uterus as well. And in general, we want to make sure that there's no physical forces that are impeding baby's freedom of movement and the comfort and growth of that uterus. So it's an extra important one for that reason, but that's probably the most common joint dysfunction. And there's also nothing to say that you can't have more than one thing at the same time. You can have pubic symphysis dysfunction and SI joint dysfunction and low back pain and ankle sprain all at the same time. There are no rules.
What about the uterine ligaments in the front? What about them getting tight?
Yeah, I mean, that is part of when we are working with our pregnant women, especially as they get into the second half of their pregnancy or near the end of their pregnancy. We do like to look at all of those things, right? Like your uterus is hanging out like a nice hot air balloon in your pelvis. And we have lots of structures that either attach from the uterus to the bony pelvis or that are abutting that uterus. So you have round ligaments and broad ligaments in the front, and then those uterosacral ligaments that wrap around and attach to the back of the sacrum. We have other connective tissue that's kind of in there you feel like your belly is going to fall over, but actually supporting that belly and holding it up. And then we also have the psoas muscles that basically are like gutter rails. If you picture like bumper bowling, that are the deepest layer of low back muscle that kind of butt right up against the uterus as well. And so really, we just want to make sure that everything is moving freely so you and baby can do your dance, do your thing, and there's nothing physical. There's no physical barriers that are getting in the way of that.
Yes, and that's why I focus on stretching out the hip flexors and the psoas, just so that they are not shortened from all the sitting, just taking gentle stretches, keeping those stretched out. But that was super helpful.
Balance too, right? Like between having something stretched and having that full range of motion, and having control of that range of motion, having the motor control and stability paired with the range of motion, right? Like it's that wonderful dance. It's Goldilocks, right? It's that not too much movement, not too little movement, in all in the right ways.
I love that. I use that all the time now from you, the Goldilocks. Not too much, not too little, just right, and listening to your body.
That's right. And what's cool too about, I will say, pelvic girdle or pelvis adjusting and in pregnancy is there's been a few studies specifically in the pregnant population where they've measured changes in pelvic floor function before and after a pelvis adjustment or a sacral or a side joint adjustment. And what's neat is it was actually a little bit different than in a non-pregnant population. And one of the things that was different was there was an increased capacity to relax and actually increase the opening of the pelvis, which is really cool to think about in a pregnant population as you're getting ready for your big day. And if you talk to any pelvic floor therapist, they'll tell you how common it is for women these days to have very tight pelvic floors, right? Like be really, and that capacity to relax is good. So improved coordination and capacity to relax in the pelvic floor is another like neat bonus side effect. It's like there's little studies, little things like that, not enough that we're going out and putting that on the billboards, but it's kind of promising and neat to see those effects as we dive in a little deeper.
Amazing. Thank you so much. That's perfect.
No problem.
You're amazing.
Whatever you need.